Good afternoon, I'm Giovanni Dennis with the Midday News. A special welcome if you're joining us online at onespotmedia.com. Out of our control, the word from the health minister as concerns mount over yet another delay in vaccines arriving in Jamaica under the COVAX facility. The second shipment of 14,400 doses of the AstraZeneca vaccine has been pushed back till Monday, March 15. The shipment, which was procured under the COVAX facility, was initially expected to arrive on the island yesterday, March 11.
We don't determine the dates. We have paid into a pool. That pool is managed, and we are told when the vaccines are available. We're given numbers. We quote and make those numbers available. The truth is we have had a revision of those numbers, but it has not been up to us. It really is up to the program we're bought into. And they have given information around production issues, production scheduling, and there are other issues, as you know, in terms of some of these manufacturers having to commit to other parts of the world based on government policies that have shifted and so on.
The shipment will be the first installment of a total allocation of 124,800 doses to be received through the COVAX facility. Dr. Tufton said the remaining allocation is expected to be delivered by May 20. Another 1.8 million doses procured under a deal with the African Medical Supply Platform is expected in April.
We don't want 4 million doses of vaccine at the same time because some of it will spoil. The AstraZeneca vaccine has a shelf life of what, 6 months?
6 months.
6 months. So for us to bring in 3 million doses of AstraZeneca, given the amount that we're administering over a period of time, we would waste some of it. So it has to be scheduled. And so what we have now is good for now. We hope to pick up more as we go along.
The government is seeking to inoculate 65% of the population by 2022. Professor of Aging Denise Eldemeyer says there are indications that there will be a high take-up of the COVID-19 vaccine by elderly Jamaicans. Speaking at a press conference last evening, Professor Eldemeyer reasoned that seniors are anxious to get back to their lives after being on stay-at-home orders for over a year.
This age group, they've been very good with the stay-at-home minister. If you notice when you're driving around, even at the funerals, you're not seeing old people out on the street. Think about it. They have paid attention to the stay-at-home. They are petrified of COVID. They don't want to die. And they equate COVID with death. Right. And therefore, for them, this is going to be about going to their regular appointments, whether it's their follow-up appointments. It's about going back to church. It's about going to the neighborhood community gatherings. So it's about getting back their life. So you are going to have a high uptake among older people, and they are ready. They're honestly ready.
Health Minister Dr. Christopher Tufton says he's comfortable with the AstraZeneca vaccine. His comment comes amid news that several countries, including Denmark and Norway, suspended the use of the vaccine after reports that a small number of people who got the vaccine developed clots. On Wednesday, Jamaica started administering the 50,000 doses of the AstraZeneca vaccine that it received from India. So far, more than 3,000 Jamaicans have been inoculated. Dr. Tufton said there is no reason to stop using the vaccine, which was approved by the World Health Organization last month.
Our position is that we remain committed to the vaccine and the efficacy of the vaccine as stated or outlined by the experts at the WHO, and even more recently this morning by Professor Peter Figueroa, who is part of that expert panel by AstraZeneca UK that has sent out communique, and the WHO's position remains. And the vaccine has been administered to millions of persons so far around the world, and we have not had incidents that could change that expert view that it is an effective and safe vaccine.
The European Medicines Agency says there is no indication that Oxford AstraZeneca vaccine is linked to an increased risk of blood clots. In a statement yesterday, the agency said the vaccine benefits continue to outweigh its risks. Health workers are racing against time to get as many Jamaicans vaccinated. Medical officers in Portland and Clarendon provided an update on day one of the vaccination drive at their respective monthly meeting of the municipal corporation yesterday. Cody and Barrett has more.
Frontline workers in Portland began their fight against COVID-19 yesterday with 30 persons receiving the vaccine. Medical officer for the parish, Dr. Sharon Lewis, provided the update at the monthly meeting of the municipal corporation.
Those who were immunized included healthcare workers, the elderly, and those with comorbidities. All adults are encouraged to take the vaccine to help to prevent the COVID-19 disease, prevent hospitalizations, and to prevent deaths.
There have been complaints from persons who have taken the vaccine that they have been experiencing side effects. But Dr. Lewis is encouraging persons not to be alarmed. She says not everyone who received the jab will experience side effect.
So if persons develop that, within 72 hours of having the vaccine, they are not to be alarmed. That's just one of the mild side effects, and it usually goes away. In fact, most persons do not even have much anything really. Right? But we just make persons aware of what the side effects could be, so that should they experience it, they are not alarmed.
Meanwhile, medical officer in charge of Clarendon, Dr. Kimberly Scarlett Campbell, said 150,000 people in Clarendon are being targeted under the COVID-19 vaccination program. She explained that the authorities hope to achieve the figure in the next 12 months. Dr. Scarlett Campbell gave the update on the parish's vaccine rollout during Thursday's municipal corporation meeting.
Right now, the work is for us to vaccinate 65 to 70% of the Clarendonian population. That translates to about 160 to 170,000 persons that we have to vaccinate by the end of March next year. So that will require us vaccinating at most of our type 3 health centers, as well as having vaccinations on weekends, where we'll have blitz operations where we try to target like 1,000 persons at a site on any given day.
Cody and Barrett, TVJ News.
5 persons have died in the last 24 hours from COVID-19. This pushes the country's death toll to 480. There was one each from Kingston and St. Andrew, Hanover and Manchester. The other 2, which were previously under investigation that should be, are from St. James and Westmoreland respectively. Their ages range from 41 to 84. Meanwhile, hospitalizations are now at 309. 43 are critically ill, while 14 are moderately ill. The Ministry of Health says there were 419 new COVID-19 cases in the last 24 hours. This pushes the number of confirmed cases to 29,387. Kingston and St. Andrew recorded the largest number of new cases with 102, followed by Portland with 86 and St. Catherine with 46. The number of active cases is now 13,763. An estimated 10 additional beds have been made available to treat COVID-19 patients at the Spanish Town Hospital in St. Catherine. This as the medical facility continues to be overwhelmed by the increasing spread of the coronavirus. Spanish Town Mayor Norman Scott says the hospital's CEO asked him to facilitate the transfer of patients who are not severely ill to the nearby infirmary where several beds are available.
All persons that came over, albeit I think 9 of them have so far taken up new residents. They are all COVID negative individuals, and so we have freed up some 9 to 10 beds at the Spanish Town Hospital for persons who are critically ill and are in need of bed space.
Don't quit. Acting Medical Officer of Health for Manchester, Dr. Shawnette Blair Walters, is urging residents of the parish not to become complacent in adhering to the COVID-19 protocols, even as the vaccination program is rolled out across the island. Cody and Barrett reports.
While addressing the monthly meeting of the Manchester Municipal Corporation on Thursday, Dr. Blair Walters says with over 260 active COVID-19 cases in the parish and health facilities and personnel exhausted, now is not the time to let down your guard.
Do not quit the physical distancing. Do not quit wearing your masks properly. Do not quit regular hand washing and sanitization. Do not quit cleaning and sanitizing our facilities, our environments. And certainly do not quit taking personal and community responsibility for your health.
She says although isolation wards at the Mandeville Regional and Percy Junior hospitals are at full capacity, services are still available at all health centers. For interested persons, vaccinations are being done at the Cross Keys, Porus, Christiana, and Mandeville Health Centers, but all must be made by appointment. She's, however, reminding the public that vaccinations are being done in phases.
At this time, we are doing frontline staff. And we have started with the healthcare workers. So the healthcare workers, we have started with them, and we will then move on to the Jamaica Constabulary, the Jamaica Defense Force, as well as the Jamaica Fire Brigade. We will then move into vaccinating those persons who are 60 and over.
Manchester now has 1,837 confirmed COVID cases. 9 persons are hospitalized and 67 persons have so far died from the virus.
I must say that there was a backlog, and so the numbers may look a little higher than normal, but still the numbers are not where we want them to be. But we are just about clearing that backlog now of results, so then we should see some differences.
While acknowledging that there have been improvements in residents' compliance, she says more still needs to be done. Kodian Barrett, TVJ News.
And it's now time for a break here on the Midday News, but please stay with us. We'll have much more when you return. Welcome back. We're continuing the news. 42-year-old Stephen Witter was convicted and fined $26,000 or 80 days in jail for various offences when he appeared in the Kingston and St. Andrew Parish Court on Thursday. Witter was arrested and charged on Monday by members of the St. Andrew North Division for several breaches, some under the Disaster Risk Management Act. The other charges he was convicted of are resisting arrest, disorderly conduct, indecent language, obstructing police, and assaulting a police officer. He's also slated to appear in the St. Catherine Parish Court on Tuesday, March 30, to answer to additional charges laid against him in that division. In one of his tirades at the Hellshire Beach, Mr. Witter could be heard saying he was not afraid of any police. He also said that Prime Minister Andrew Holness could not give him any directive. The Jamaica Bar Association says there are several aspects of the National Identification System NIDS bill which must be addressed before it can be passed into law. The association highlighted the issues at the latest meeting of the Joint Select Committee, which looked at the legislation recently. As we hear in this report from O'Shane Masters, one of the issues highlighted is that of access to information on the national identification and civil registration databases of NIDS.
It's a question of who will be able to access information on the national identification and the civil registration databases when the legislation comes into effect. Concern has been raised by the Jamaica Bar Association, which has been doing an in-depth analysis of the legislation to ensure that the constitutional rights of Jamaicans are not being breached. The first issue raised is access to information on both databases under the legislation. The Bar Association noted that persons who are not eligible to be on the platform will have access to the information stored. Representatives from the Office of the Chief Parliamentary Counsel responded.
The purpose of the provision was to entitle such a person to be able to verify that information about them is not in fact being stored in the identity information side of the database.
What the bar is asking, why should they have this right to check? I mean, they're not a part of the database. Who gives them the right? I mean, on what basis are they checking?
They're checking to ensure that there is not in fact information because they're not eligible to enroll. There shouldn't be any information about that individual in the identity database. So this enables them to verify that in fact information pertaining to them is not being stored in the database.
Chairman of the committee, Delroy Chuck, also commented on the issue.
What I have here, Bar Association, is that an individual, including the diplomats and so on, they don't want to enroll, or they should not enroll. They can easily check on the Section 25 to ensure that they're not enrolled.
The Bar Association's recommendation is that Section 4.3 of the legislation should expressly limit the information accessible under Diplomatic Immunities and Privileges Act to that stored in the Civil Registration Database, which means the individual would only be able to have access to information from the Registrar's General Department, which will be subsumed into NIDS. But concern is still raging as members of the committee believe persons who are not eligible should not have access at all. Committee member Kamina Johnson-Smith is adamant that if an individual is not eligible to be on the database, then they should not have the right to research any information from the platform.
If it were an option and they could or could not, and they wanted therefore to just verify, but they are not eligible, and therefore if the intention was not to have them ask for their information, to verify any information about them in the civil registration database as is being proposed by the bar, then my question would be, why is this in there at all? That's really the view that I have, that why is it in there at all?
Well, I would like to invite consideration of a scenario where an individual who might have been enrolled but subsequently becomes entitled to immunities and privileges and thereafter is not eligible to be enrolled, and therefore their enrollment should have been cancelled and their information purged from the system. Right. In such a case, that individual might want to ensure that their information has been purged.
O'Shane Masters, TVJ News.
The Statistical Institute of Jamaica has concluded its crime victimization survey for the period September 2018 to August 2019. The initiative is to gather people's perception of public safety and the criminal justice system. The survey measures the incidence of crime from the perspective of the victim. Data were collected from some 6,354 households across the island.
The report also includes information on the type of crimes not reported to the police and an estimate of the cost of crimes to households and individuals in Jamaica.
According to the survey, of the 897,800 households visited, 9% or 80,000 residents experienced a household crime. 462,551 persons experienced a personal crime, with burglary accounting for the largest number. Data on people's perspective of safety in their communities showed between 80 to 90% of persons felt safe in places such as their home, work, school, and personal vehicle. Between 70 to 78% felt safe at the market, public park, bar or club, and in public transportation, while 56% felt safe at ATMs. For perception on the effectiveness and reliability of authorities and crime reduction activities, responses were positive. However, the survey shows low public awareness of the functions of social intervention projects. National Security Minister Dr. Horace Chang says that is unfortunate that less than 20% of the population seems familiar with most of these programs.
This low public perception, the low public perception of these social intervention programs, a clear indication of the weakness of the project type interventions and the weakness of the separation of projects from the mainstream social events of the country. And it also reflects the kind of unnecessary separation of the various project silos, and then you end up with a lot of the funding being spent on staffing all over. So in fact, the communities don't feel the full effect of our investment.
In news overseas, some EU countries have suspended use of the AstraZeneca vaccine for, quote, adverse reactions, including concerns about blood clots. But the European Medicines Agency and the UK continue to be backing it. More from the CNN.
Here in Europe, several countries announcing the suspension of the AstraZeneca vaccine rollout, or at least the suspension of the rollout of some of its batches. This after concerns were raised in a number of European countries about possible blood clots that had been found in patients who'd been inoculated. The European Medicines Agency has reacted, saying that it does not agree with the suspension. France's foreign minister as well, saying that France will continue. This is what he had to say Thursday evening.
Investigations are carried out systematically each time serious adverse effects are declared. But what are we talking about? About 30 people out of more than 5 million Europeans having received an injection.
The news of those suspensions, though, in European countries, another blow to the rollout of the European Union's vaccination programme that has been beset by supply issues for the last few weeks. One bit of good news on that front, though, the European Medicines Agency announcing that it had approved for marketing the Johnson & Johnson vaccine. That decision, though, now needs to go to the national health agencies before deliveries can begin of the 200 million doses that have been promised to the European Union this year, something that could help improve the rollout that we've seen so far.
And in sports, Sri Lanka has made 273 from their allotment of 50 overs. This in the second one-day international against the West Indies at the Sir Vivian Richards Stadium in Antigua. Danushka Gunathilaka has top scored with 96, while Dinesh Chandimal made 71. Jason Mohammed took 3 wickets. The Windies, Alzari Joseph for the Windies took 2 wickets. The West Indies have gone with an unchanged team for the match and are seeking to take an unbeatable 2-0 lead in the 3-match series. And that's the Midday News. I'm Giovanni Dennis. Please stay tuned for primetime news at 7. On behalf of the news, sports and production teams, good afternoon.